their doors to new applicants, which therefore increased the number of those living on the street. The only way to ensure that all citizens have an equitable opportunity to remain safe and healthy is for our governor to act now to ensure that there is a complete guarantee for housing. Quoting Dr. John Lumpkin, who's president of the North Carolina Blue Cross Blue Shield Foundation, the health of our state is the sum total of the health of the community. In order to flatten the curve in North Carolina, the state and our policymakers must take a community approach to solving this health crisis. And this includes guaranteeing that there is housing available for all citizens in our state during this pandemic. Thank you.
Thank you. Thank you, Yolanda. Our next speaker will be Ilea Wallace with Democracy Green in Morganton, North Carolina.
Thank you, Ms. Newsom-Bass. Hello and good morning, everyone. My name is Ilea Wallace. That is ILEAHWALLACE. I am a native of the Blue Ridge Mountains here in North Carolina and a council member of Democracy Green. We are an organization that elevates the needs of rural communities, environmental justice, and democracy reform and human rights for all people. In this time of uncertainty, we urge our elected leaders to heed these demands and protect all North Carolinians through guaranteed housing, namely our rural communities who are often overlooked and under-resourced. There is a perception that in rural areas, especially in the mountains, that we are insulated from urban issues. That is not so. As we've seen our 8th case of COVID-19 in my hometown and similar numbers in surrounding counties, we understand the danger that is facing us. While it is not near the hundreds and thousands of cases seen in urban areas such as Charlotte, Raleigh, and Durham, know that the impact can be just as traumatic for an under-resourced rural area. With the lack of financial support for our hospitals, lack of affordable housing, access to jobs, and the broadband divide, we find ourselves unprepared for a virus as uncertain as COVID-19. In September of 2018, when Hurricane Florence took a damaging hit to the housing security of those across the state, many lost their homes, were displaced, and were forced to migrate, seeking shelter in Western North Carolina. I witnessed this population shift firsthand, as well as the hardships faced by a survivor and her family. Amber, a close friend and former coworker of mine, was one of many who lost everything in Hurricane Florence. She, her husband, and her 3-year-old daughter were left homeless, without a car, and forced to move to Burke County, where I currently reside. I have watched her and her husband struggle to find work, suitable housing, and overall be unable to provide a secure life for themselves and their daughter. For months, I saw Amber struggle to receive relief from our county's local assistance programs due to an increased need and a lack of resources and preparation. She and her family have just recently been able to secure affordable housing in 2020. This lack of affordable and suitable housing is not just an issue that arose as a result of Hurricane Florence. This has been an issue in rural communities for several years. According to an article published in the Morganton News Herald, the homeless population in Burke County has increased by 18% since 2017. Our rural communities are not equipped with the experience, the resources, nor the tools to protect ourselves from COVID-19. Without immediate address of these needs by our elected officials, we will be left once again unequipped to protect the security of our families and our state as a whole. In the mountains, we have been a safe haven for families as they fled hurricane disasters in the east, migrant communities as they fled the threat of ice during these same climate disasters. While we have been an emergency retreat for families rebuilding from these disasters, we have had a rise in homelessness due to lack of affordable housing and infrastructure to support these families. Now, with the reality of coronavirus, we need guaranteed housing to mitigate the spread of this disease. We are urging our leaders and everyone to stop all evictions. We need public Wi-Fi access during the time of this pandemic. We need to stop criminalizing houselessness, and we need it now for the survival of our communities. Thank you.
Thank you, Ilea. Our next speaker will be Juvencio Rocha Peralta with the Association of Mexicans in North Carolina. And Juvencio is joining us today from Greenville, North Carolina.
Good morning. Thank you, Ms. Bass. It's a pleasure to be here with you this morning. I will talk to you about what is going on within our immigrant community in the state of North Carolina. Our immigrant community has always been in fear for ICE, and today, as we see it, the pandemic of COVID-19 has increased more fear within our communities, but also has also created a way that our community is not prepared, and our elected officials not even aware of what this community is facing today. Our immigrant community has struggled to survive, and now with COVID-19 even worse. Our immigrant community has continued to have challenge in terms about resources. So we urge our government of the state of North Carolina and our elected officials across the state to look at the situation of this immigrant community. We know that immigrant community is a great force for our state and our communities. We recognize that our immigrant community is also a hardworking community that has overcome so many challenges. But today more than ever, we had to come together and address these things. I will share with you just one thing that happened in Florence. When our immigrant community in rural Eastern North Carolina got hit by this storm, they were not prepared. And our community, even worse, was not prepared. Our local elected officials not even aware that this community was living in some of these disastrous areas. We had to create a conscience that we all as human beings in our communities, regardless of a status, regardless where we come from. We contribute to the state of North Carolina every single day when we get on the road, but we are communities that needs some attention. One of the biggest challenges that we see today is this community is already calling us for help, for housing, rent, light bills, food, and 50% of our community undocumented. But regardless of if they're undocumented, they're part of our communities, but also they contribute to our communities. They work in farms, construction, services, and you name it. So we call the state of North Carolina, we call Roy Cooper, and we call the elected officials that please pay attention to this community. They have great access to our state, and we cannot forget them and push them out on these situations that we live today. COVID-19 has gave us now an opportunity for us to come together and address this issue as a community. Thank you.
Thank you, Juvencio. Our next speaker will be Liana Humphrey. Liana is with the Crisis Assistance Ministry in Charlotte, North Carolina.
Thank you and good morning, everyone. Crisis Assistance Ministry is the lead agency in Mecklenburg County, working to prevent homelessness by providing emergency rent and utility assistance to families in financial crisis. With the wonderful news that evictions were temporarily being halted and utility companies were not going to be conducting disconnections, the customers that we usually see in our lobby, and we see nearly 200 families a day, receive some temporary relief in terms of not having to worry about their being evicted or having their utilities disconnected. However, the COVID-19 crisis has exposed a gap in our housing services delivery system. We quickly learned that individuals living in hotels found themselves caught between the shelter system and the protections that were being provided when they temporarily halted evictions. So Crisis Assistance Ministry was asked to step in to prevent this vulnerable population from becoming homeless. Many of the families that live in hotels are low-wage workers who experienced either a complete loss or a reduction in income as a result of COVID-19. And clearly the fact that they are calling hotels their primary residence indicates that they're living paycheck to paycheck and lack the ability to save in order to be able to put down an initial deposit on an apartment. So these are very vulnerable families, and the loss of income put them in immediate financial crisis. To date, Crisis Assistance Ministry has helped more than 1,000 families in over 50 hotels in Mecklenburg County remain stably housed, to the tune of over $500,000 that we have spent in private funds from the agency. As we've been working to prevent homelessness with this population, and this is not a type of housing that we typically serve, so we've been, sort of building the plane as we fly it, so to speak. But we have learned that they are covered by some of the same eviction laws as apartment dwellers. So we've been working closely with our partners at Legal Aid to use legal means to prevent further evictions and allow people to be able to shelter in place for the duration of the governor's order. Hotel evictions, as I mentioned, are not something that either Crisis Assistance Ministry or Legal Aid have focused on as part of our core mission in the past. Our organizations and other advocacy groups in Charlotte are having to pivot to serve this population while also adjusting to a virtual service delivery model, which again is not something that has been part of our 40+ year history. The need continues to grow daily and is overwhelming at times. We need more short-term assistance as well as longer-term solutions to ensure that everyone has stable housing, including these families that are really living on the edge.
Thank you, Liana. Our next speaker will be Shimei Phillips. Shimei is a senior undergrad student at North Carolina Central University in Durham, North Carolina, and is a campus coordinator fellow with Advanced Carolina. Shimei?
Hi, how are you doing? My name is Shimei Phillips again, and I am a student and a fellow with Advanced Carolina, and I'm here to bring some awareness on students and housing. So there has been a lot of conversation about students in on-campus housing, a lot of students being forced to move home, or certain students with special circumstances being able to stay on campus. But however, there has been lack of conversation about students living off campus. And there are two different types of off-campus housing. There is off-campus student housing and regular private off-campus housing. So now students are put at very big financial burden. Because a lot of students have lost their jobs, whether that's because the campus closed and they had an on-campus job, or they had a regular job. Both of these have closed, and now they're put at a hard predicament. So some students are now forced to move home because if you can't afford to pay your rent, you also can't afford to pay for groceries or any other living expenses. So they move home to have some place to stay. But not all students have that fortune to be able to move home. So now some students are living homeless. So now we're trying to come up with the help to the students. Should the students be able to break their leases? And also, when the students are able to break their lease, how can we help these now homeless students and students left with a burden?
Great, thank you, Shimei. Our final speaker will be Dr. Gina Newsom Duncan. She is a psychiatrist in private practice in Charlotte, North Carolina. Gina?
Good morning, and thank you, Mrs. Newsom Bass. Again, my name is Dr. Gina Newsom Duncan. That's spelled GINA-NEWSOMEDUNCAN, and I am a psychiatrist in private practice in Charlotte. So I wanted to share some information with you all regarding mental health and why housing is so crucial to a discussion of mental health and vice versa. Mental health first must be understood from a biopsychosocial spiritual framework. Optimal mental and emotional health require that we are functioning well in each of those dimensions. But for far too many individuals in the United States and in ranking includes access to insurance, treatment, quality and cost of insurance, and access to special education and workforce availability. And on those measures, North Carolina ranks 44th in the nation in access to services. Over half of North Carolinians with mental illness do not receive any treatment. And this should be a sobering statistic for anyone to hear. As has been stated by other panelists, the health of a community, a state, a society, is dependent on the health of its citizens. And the COVID-19 pandemic is making this devastatingly clear. During this time of tremendous uncertainty, fear, anxiety, and loss of life, it is critical that we act to secure those things that can be secured. As a psychiatrist treating patients on a daily basis, I can speak firsthand to the mental health impact this crisis is already creating. And I can state with certainty that a broader mental health fallout, increases in rates of depression, anxiety, post-traumatic stress disorder or PTSD, substance use, and suicide is on the horizon if we do not act swiftly to provide individuals and families with the resources needed to stay well physically and mentally. Again, we have to look at mental health using a biological, psychosocial, and spiritual framework. Secure housing is at the core of this framework. Most people are probably familiar with Maslow's hierarchy of needs. Housing, shelter, is a basic, fundamental human need. Without secure housing, it is nearly impossible for a person to achieve optimal physical and mental health. And to conclude, mental health providers across this state are scrambling and working tirelessly to quickly adapt our practices to this new normal. Our efforts have been aided by the changing of regulatory practices to allow coverage of telemental health services. We want to ensure continuity of care for our existing patients. We know that impending job loss will significantly impact health insurance and housing for our patients, and that without these resources, they won't be able to access the health services that we are here to provide. But we also want to ensure that pathways to care are opened up for those who are or will be in need of services. We appreciate the steps Governor Cooper and local officials throughout the state have already taken to address this developing crisis. But further support is needed to support the mental health of our citizens by ensuring housing and income security for our most vulnerable populations. COVID-19 has presented us with unprecedented challenges, and yet through it, we have an opportunity to find better ways to care for our fellow North Carolinians in a way that can keep them whole and lead all of us to a better quality of life. Thank you.
Thank you, Gina, and thank you all of our speakers. So before we open it up to questions, let's review just very quickly again what we are asking for today and the campaign that we are launching beginning today. If we can go to our slide where we have what we are asking the governor to do in this moment. So we are aware that the governor issued another executive order even since the time that we first published our document and launched our petition. On the 31st, he issued another executive order kind of making recommendations around the issue of evictions. But we're really asking the governor to just flex some more of the power that is uniquely within the governor's office. And that is number one, to issue an executive order guaranteeing safe, stable housing for every resident in North Carolina. So this is a blanket coverage that acknowledges that housing is step one when it comes to public health, and particularly when it comes to responding to the COVID-19 crisis. People simply need a home in order to stay at home. And so this would mean canceling all evictions and foreclosures. We have had a situation where the matter of evictions and foreclosures has largely been a county by county issue. And so in some counties, we've had the sheriff, for instance, make the promise that they would not carry out evictions, but that has not been the case necessarily across the state. And as you heard from our various speakers today, there are a lot of people that continue to fall through the cracks. This is an unprecedented crisis, and we really need the leadership of the governor's office in this moment to create a statewide public health plan guaranteeing that everyone will have safe, stable housing regardless of their status. That includes ending this sweeping of homeless encampments, and that also includes freezing rent so that people are able to know that at the very least they will have housing through this crisis that everyone is going through. Our second demand that we are asking Governor Cooper to act on right now is to decriminalize houselessness and to provide safe housing alternatives to jails and correctional facilities. So even in normal times, we have an issue where people are criminalized simply for the fact that they do not have housing. If you do not have safe, stable housing to go into, you have nowhere else to go except really into public spaces. And this leaves you vulnerable to police harassment and other forms of violence. We are asking the governor's office to really lead the way on destigmatizing people for being without housing. There are a number of people who were without housing before the pandemic started. There are a number of people who are now falling into a state of houselessness because of the pandemic. And it's very important that we recognize that everyone is a human being, everyone is deserving of dignity. And in this moment, everyone is deserving of what they need from a health standpoint. And so we want to make sure that we're not taking any measures or policies that are going to further criminalize and stigmatize and penalize people for being without housing. And we also need to provide safe alternatives to jails and other correctional facilities where people would typically be placed in certain situations, because those facilities themselves are also becoming hotbeds for the spread of the pandemic. And then thirdly, and we detail this a bit more in the document, which I shared out in the chat, I will share the link out again here. But there are a number of measures that we need to take further to make sure that once people are safely and stably housed, that they then have everything that they need to have a good quality of life, particularly during this period of pandemic, as Dr. Newsom Duncan spoke to, where people are dealing with even heightened levels of crisis and mental health, stress, and all of those things that come with it. So that includes making sure people have access to the nutrition that they need. That includes making sure that people have access to things like public Wi-Fi so that they can continue to do their studies, connect to remote learning, stay connected to vital communications that they need at this time. We also really need the governor's office to advocate on our behalf to the federal government and make sure that everyone is getting the kind of direct economic assistance that we need in this time. Again, like I said, there are amazing people in the state of North Carolina who are doing really great work on a local level to help the people in their community as much as they can. But we need the governor's office to bring the full power and resources of that office to bear, and to really bring all of the partners to the table to lay out a statewide consistent public health strategy, so that no matter what county or zip code you live in the state of North Carolina, you can have assurance that you will have what you need for your health and well-being during the extent of this crisis. If we can go to the next slide. This is the campaign that we are beginning today. #NeedAHome to stay at home. We feel it's very important that people who are impacted, particularly by the issue of housing stability in this moment, are not overlooked and really have their stories and their voices lifted up. And so what we are doing is using this hashtag as a way for people to take a photo of themselves, holding a sign or writing a message, sharing their experience of how housing instability is impacting them in this moment and what they really need. We're asking everybody to tag that to the governor, tag it to your local leaders and representatives, both at the state and federal level, with the hashtag Need a Home to Stay at Home. If you are personally impacted, share your message. If you are somebody who has stable housing right now, but you understand what it would be like if you did not have stable housing and you want to share a message of support, you can also use that hashtag, and we will be doing that online. And the next slide. We also have our petition that we have been asking people to sign and share online. It already has garnered over 1,500 signatures. As I said before, this is the link, and you can also hold your smartphone camera up to this QR code, and if you hold it up there, it will take you directly to the petition, so you can access it there as well. And we have, as I said before, those first two basic demands that we are asking of the governor, but also just detailing more of some other things that we need to have happen, including making sure that people are still having the access to the ballot and the ability to complete the census, and just all of these various things that have been disrupted by the pandemic, but that are made even more dire when people don't have access to safe, stable housing. So again, thank you everyone for attending. At this point, we will open the floor for questions. If you could please type any question that you have in the chat, and I will be sure to direct it to whoever it makes best sense to direct it to, unless there is someone in particular who you know you would like to direct a question to, please indicate their name and we will take some questions. We're going to open it up to the media and press who are present first, and then we will open it up to any of the public who are joining us. So if we have any questions. Hi, this is a question from, let's see, David Borax. He says, what specifically do you want the governor to do to provide housing? Is there a dollar amount of an appropriation, and how would this be done? So I guess I can answer that question for you, David. So what we are really asking for the governor's office to do right now is to really take a mantle of leadership, right? So you heard, for instance, from Liana Humphrey with Crisis Assistance Ministry. And Liana, I think I'll go to you after I provide my answer, so maybe you can talk about this a bit from your perspective. But we already have what's happening on a very local level is people are pulling together money and resources, dealing with people who are in a crisis situation right now, right? So we know what it looks like in terms of a dollar amount on a day-to-day basis in our communities, but what we really need the governor's office to do is to bring the necessary parties to the table to devise a plan for what it would look like to house everyone who needs housing right now in the state of North Carolina. In the document that I shared out in the chat, we talk about, for instance, doing an inventory of all the hotels, of all the motels, of all the public property, any private property that might be available, and identifying who needs to be housed right now, to what capacity, and then we would assign a dollar amount to it. But the primary issue that we are running into right now is that there just is not that statewide coordination happening, and that level of resources coming to the table that we need. Liana, would you like to speak to that?
Yes, just getting off mute and navigating to some notes that I have about different policy options that we've been discussing with other advocates across the state. I think one immediate action that needs to occur is to extend the stopping of evictions. That currently that date runs through April 15th. And as we know, we are not going to be out of this crisis by April 15th. And so one action that needs to happen statewide is to extend that stopping of evictions beyond that date. There are certainly other states that have offered, I think, some good examples of other ways that we can support families and tenants and landlords, and certainly some other things, actions around unemployment benefits, as well as Medicaid. These are all going to impact the income and budgets of low-income families to ensure that they're able to remain stably housed during this crisis.
Thank you. Let's see, we have a question from Lauren Lindstrom. Are there policies that other states or localities have taken that you would like to see replicated here beyond the asks that are outlined already? And I guess, Liana, you've spoken to that a little bit. Is there anyone else who would like to speak to a model that you have seen in other states or localities that you would like to see replicated? I know, like, for instance, one thing that we were looking at was like the mental health hotline that was put together in New York. You know, those types of statewide strategies, if we can bring experts together from various sectors and localities in North Carolina to create a broad and clear statewide health response in this moment is essentially what we are looking for.
Bree, if I can just jump in there too, I think there are also other states that are looking at providing rental assistance to families using some of the federal and state funds. So going beyond just preventing evictions, but then also really helping families once the courts do reopen, because as we know, those bills will have piled up in the meantime. And when the courts reopen, you know, that's a huge burden on low-income families to be able to get caught up on their rent.
Yes, exactly. And let's see, Amelia Cohens-Taylor asked, how does the strategic plan impact those facing eviction? And so this kind of ties with the last question as well, which is what we are calling for is guaranteed housing. So that means that everyone, regardless of what your status is right now, we would be looking for a solution to ensure that everyone is housed. So that includes both putting an end to evictions, and as Liana said, making sure that whenever we mark the end of this crisis period, that those people are still not, you know, allowed to fall through the cracks or have their eviction, you know, resumed when people are still going to be recovering. But it's also about making sure that anyone who doesn't have stable housing has the housing that they need right now. So another potential model that's working out in a locality, as I mentioned before, is in Mecklenburg County. The county commissioner there acquired some motel space. Now, what they did was they got space specifically for housing people who begin to show symptoms of COVID-19 and need to be isolated. What we are saying is, why can't we kind of apply that same logic to anyone who needs housing, period? So instead of only having the resources or having to wait until someone is actually sick before we provide housing, let's get everyone housed now and reduce the likelihood of people contracting it. Let's see, Wanda Hunter asked, how do we get an executive order to have some of the heads in beds taxes redirected to help families who live in hotels during this pandemic, considering they are the primary investors? Liana, are you familiar with? I'm
not, I'm afraid.
So I don't have a direct answer to that question. I don't know if there is anyone on the call or one of our panelists who would, but I think that the short answer is basically that is kind of what we're asking the governor's office to do. So the order that the governor put out on March 31st was largely a list of recommendations. He did halt, for the most part, utility shutoffs until the end of this month. But beyond that, it was mostly recommendations. And so we're really asking the governor to just put a bit more teeth into it and do things like that. Like, can we, you know, use the heads in beds taxes to provide housing for people in this moment? Let's see, from Uhuru Hilton, what specific parties does the governor's office need to convene? Well, we know that the governor has various secretaries who are over different departments, and this is clearly an unprecedented situation. We would really need the governor to appoint people to be over these various issues, whether it's addressing mental health, whether it is, you know, housing people immediately, whether it is making sure that children who were receiving free lunch programs during the school year are, still receiving the meals that they need. But we need it all to be coordinated from the governor's level. What we are saying as local advocates is there are amazing local and county level advocates who have solutions, who have ideas, who are already doing rapid response work around these issues. What we need is statewide coordination, and we need the executive authority of the governor to bring more resources and power to bear, both from the state level and also to advocate to the federal government to make sure that our state is getting the resources that it needs. Would anyone else like to speak to the types of parties that we need the governor's office to convene in this moment?
I was just going to piggyback on what you have said, Ms. Bass, which is that there are communities already, before this pandemic, solving community problems like eviction diversion. I know Durham, North Carolina is a wonderful example, and Charlotte is a wonderful example of where communities before this pandemic had coordinated efforts right there on the local level to solve the problem of evictions. So if a local community can do that outside of a crisis, I do believe the governor, with his broad police powers, can act in this state of unprecedented emergency to coordinate, as Bree stated, a statewide effort to provide assistance to landlords who may also, we acknowledge, may be struggling, and who will like to keep their tenants in their homes if they were themselves granted some type of housing assistance fund. And those are things that are being done now in Charlotte and Durham by some of our legal aid advocates.
Thank you. Let's see, we have a question from Courtney Mabius, who was asking if we could get the link to Dr. Newsom Duncan's PowerPoint. And let's see, Dr. Newsom does not have a link, but can email it to anyone who would like it. So if you want to maybe drop your email, you can drop it in the, if you select just to the panelists, if you don't want your email to be public, if you'll put your email right there, we'll make sure to email it to you. Let's see, Eleanor Wood, this seems like a good question for Shimei. Eleanor Wood is asking, what immediate actions do you feel are needed to assist students as they are losing jobs and housing with the closure of college campuses?
Hi, some universities are offering like relief forms. So they're giving out fundings for students who need some like relief due to the COVID-19. So that would be a really great way to help. And also with getting support, talking to landlords and figuring out maybe different legal action to take to break the leases of students.
Great, thank you. Let's see. Mike Long asked, what are the minimal standards to define safe, stable housing? That's an excellent question. So safe, stable housing means obviously it is safe for you to live in. So that means the conditions of the physical building that you are in are actually safe, right? Because one of the issues that we have had in housing already is that some people are technically housed, but the housing that they are in is not in a safe condition. Safe also means that it's safe for you to reside within whatever housing you are in right now. So some people, to shelter in place is not safe because maybe they are dealing with abuse or other situations in the home. Again, these are housing situations that housing advocates are dealing with in the normal times, right? These are normal crises, and now it has been compounded by this pandemic. And so what we need, again, for the governor to do is to make sure that everyone is housed, but also meeting a certain standard of safety. And in addition to what I already mentioned, again, having access to nutrition, having access to the basic things that you need in order to have a decent quality of life while you are within housing. That's kind of what we consider the baseline of it being safe. And then of course, stable means how long are you guaranteed to be in that housing, how secure is your residency there, because some people are housed, but they don't know how long they will really be housed in that location. Let's see. Courtney Mavis asked, do you have any reliable stats on the number of homeless who have tested positive for COVID-19? I'm aware of some organizations that are providing hotel rooms to offer a place to self-isolate. Is there a centralized organization behind that? From what I can tell, it is piecemeal. Liana, do you know of any centralized organization behind that effort, or is it looking largely piecemeal?
I'm only familiar with what's happening here in Mecklenburg County, and I forget the exact number. I think it was around 60 or so homeless people that were currently being housed in a hotel due to either having tested positive or having symptoms. So I'm not sure about statewide.
Thank you. And I will try to pull for you in just a second, because John Autry's office just released some stats on COVID-19 in North Carolina. And so I will see if I can pull those numbers for you in just a second. Courtney, let's see, Barbara Smalley McMahon says, some of us have homes we could share with those who are houseless. In order to do this safely, this would require the state providing COVID-19 testing. Is this a request we could add to the petition? Yes, theoretically, yes. So if you want to click on the link that we have for the petition, and if you have signed your name and post a comment there, you can add that comment there. The document that we put out, that we attach the petition to, is really us lifting up recommendations, very broad policy recommendations that we are saying from our perspective as local and county level organizers across the state, that we need to see being implemented on a statewide level and having statewide coordination. But you can also use the hashtag need a home to stay at home to lift up ideas that you have about how we can resolve things in this moment. You'll see on the document that we published at the very end, the very last section is titled A Call to Action. And we say how what we are really calling for in this moment is for everyone to come together, from the grassroots to the grass tops, because this again is an unprecedented moment, and it's going to require everyone working together in unprecedented ways. So if you have ideas to contribute as a resident of North Carolina, we encourage you to tag your leaders with the hashtag need a home to stay at home, and let them know your ideas. Let's see, Adrian Kennedy asked, hi, is there anyone that could help me understand how the COC continuums of care for the homeless and homeless prevention auspiced by HUD can act and operate during this time? Can anybody speak to HUD? The role of HUD in this moment?
I can, as it relates to the continuum of care. I have had the fortune to be a part of one in rural North Carolina. I do know that Congress recently passed, as we all know, that $2 trillion COVID-19 aid package, and included in that package was $4 billion in emergency solution grants to assist homeless shelters. So it will be a matter of the continuum of cares in various communities advocating to the state for some of that money to be provided to their specific community. But in that national package, there is money to provide additional sheltering and rapid rehousing for those who are homeless or at risk of being homeless. So I think that's one way that they can. It would be, I guess, up to each COC to advocate for more money or a drawdown of those funds that are coming to the states. And I don't know what the breakdown of that amount is to North Carolina, but the narrative is changing every day. We're reading different things that are coming out and being released, but I do think our governor and our state can advocate to the federal government for additional funds. And whatever funds the state gets, I'm advocating that maybe those funds should be, trickled down to our individual communities.
Great, thank you. Let's see. Yes, everybody who wants access to the PowerPoint, and I see also a request for the list of all of the speakers' names and follow-up contacts, we will be sure to send that to you. If you can just drop your email here, we will send that to you. And also the recording of this press conference will be available shortly on the Advanced Carolina Facebook page as well. Let's see, we have a question from Shanila Lee asking, does anyone know if the governor is working with Judge Beasley, who helped with the eviction moratorium, pull the state and law together to come up with solutions? So the last order that came through from the governor's office on March 31st was essentially reiterating the order that Judge Beasley put into place, but it still largely amounts to recommendations. You know, it's kind of a recommendation that the county not proceed with any new evictions. But beyond that, it's not really any kind of firm mandate. And there's, again, of course, a lot of people who really end up kind of falling through the cracks because it's largely up to landlords and property owners. And we know that most of our, some of our most vulnerable community members and those who are dealing with housing instability, it's because they are in predatory landlord situations. They are already in situations where the landlord is neglectful in, maintaining the property. We have a lot of people who are placed on month-by-month leases, which makes their situation very precarious. And even though the governor's office and the Chief Justice have made these recommendations, we don't know for certain that that information is really being communicated from landlords to their tenants. So yes, tentatively, the governor has done some stuff with Chief Beasley, but we, again, really are wanting him to just exercise a bit more power in making sure that there is follow through on all of these things. Okay, we are coming up on 11 a.m. Are there any other questions from press or community? Let's see, we have Celeste Gracia says, can you please give specifics on what safe and stable housing looks like for the homeless? You point to what Charlotte has been doing with housing some people in hotels. Do you suggest doing that statewide, except as a preventive measure? You call on Governor Roy Cooper to provide this housing for the homeless, but how? Yes. So the hotels and motels are purely a suggestion. That is one idea, right? And we are operating with that theory, again, based on the fact that we already have somewhat of a model for that. So in Mecklenburg County, we had the county commissioner secured some motel rooms to house people who needed to be isolated as they were showing symptoms. In Washington State, the government there actually secured an entire motel property to house people who were unhoused. So that is one possibility. And as somebody else mentioned, we can possibly use some of the tax revenue from the hotels in order to cover that. But we should really be looking at as many housing options as possible. And that's why in the document we published, one of the things that we asked the governor's office to do is to begin by doing an inventory of all possible housing options in the state, an inventory of everyone who needs housing, what those various situations are. That might include having a place, for example, for people who would typically go to a domestic violence shelter, perhaps, and we need some other place for people to go so they can be safely and stably housed and practice physical distance during this time. So we're not limiting it to hotels and motels. The other thing I wanted to reiterate as well is that we are talking about a response to the pandemic in the immediate. So looking at hotels and motels as an immediate place for people to be housed, but that's not a long-term solution. And I think that's important for people to understand as well. And Liana, if you want to speak to this too, the hotels and motels and people who were residing in those places even before the pandemic began, that's already like a crisis form of housing. That's not really stable housing. That's emergency housing for the most part, right? And so we're talking about hotels and motels as possibly expanding that kind of emergency shelter for right now, just to make sure people are housed so we can reduce everyone's chances of contracting COVID-19. But long term, what we need to look at is how do we make sure that everyone has safe, stable housing in perpetuity? Imagine where we would be at as a state if we already had guaranteed housing and stable housing for everyone. We would be in a much better position in terms of responding to this current health crisis. Is there anyone else that would like to speak to that, like what it means to have safe, stable housing in this moment, what that would look like?
I think you're exactly right, Bree. Hotels are just a stopgap measure. And I think one of the things that's been alarming as a community is just how many people are calling hotels and motels their primary residence. You know, we knew that families were living in hotels, but this has really exposed the extent to which that is people's primary housing, and that for most of us, I think, is not acceptable.
Yeah, and what I was going to say as well is that, I mean, this is our first pandemic of a virus, but this is not our first disaster as a state. During natural disasters, we've seen communities pull together and convert public spaces into shelter for those who were impacted by natural disasters. So I do think a more thoughtful and coordinated approach, and maybe converting public spaces to expand the space of shelters. Our current shelters are usually not that big. So if a public space could be converted, I do believe in a state of emergency, the governor has these very broad powers to act and convert public facilities for the state's use in order to deal with these this disaster and this pandemic. Schools, convention centers, I mean, those are all other examples of places that could be converted to house the homeless.
Absolutely. Now is the time to bring everybody together, all hands on deck, no options off the table, all kinds of imagination. We'll take these last two questions. The first is from Ismail. He says, what are some measures we could take to ensure that the 120-day HUD moratorium for tenants is enforced at the state level? Is there anyone who would like to speak to that? So if not, I can answer. Again, this is where we really need the governor's office and some of the unique authority and resources that the governor's office has to make sure that that the HUD moratorium is carried out. Like I mentioned before, one of the issues that we are seeing is that even with some of the orders that are coming down from the governor's office, it doesn't necessarily mean that landlords are following through on those recommendations or that they are really fully communicating that information to their tenants. And, again, you have local advocates who are trying to fill the gaps in these places, putting together informational sheets, giving it out to tenants, trying to make sure people have this information. But to have that type of thing happen at the level of coordination that we need it to happen across the state, from urban communities to rural communities, we really need the governor's office to take the lead on that. And the great thing is that there are these amazing advocates across the state that the governor can reach out to and work with. And then we have from Kathy Greggs. Kathy says, hello, the issues here in Cumberland County is people are getting arrested for child support. How can we force them to let everyone free? Why is drive-through testing at a secret location? And why is the Salvation Army kicking people out? Again, I don't know if everyone on this call, I'll certainly open it up to our panelists, if there's anyone who wants to speak to any of these various issues that have been lifted up by Kathy. But everything that Kathy is touching on is, again, exactly why there has to be a much more comprehensive statewide public health plan for how we are responding to the pandemic, because it's not business as usual. And yes, it is disrupting every single facet of our regular, daily life. And we need to make sure that people have access to housing. We need to make sure that people have the economic relief that they need immediately. And we need to make sure that people have access to the health care and the testing that they need right now. Is there anyone else on the panel who would like to speak to that?
I was just going to say that you also mentioned you wanted to know why is the Salvation Army kicking people out. Shelters at the local level are having to do that in order to comply with social distancing. And as stated in my presentation, they are also now refusing to take new applicants. So that's why we're saying that this needs to come from the governor. There needs to be a statewide coordination to guaranteeing housing, because local organizations in and of themselves are unable to do that at this time.
Great, thank you. So we are going to get ready to close out at this point. I was wondering if we could pull up the slide that has the link to the petition, that has the QR code for anyone who needs that. That will take you to the petition site, and it also has a link to our document there. I wanted to share real quick where Yolanda pointed out that the minimum housing standard, I believe it is, for safe, stable housing as it is defined in the state of North Carolina under law, includes having running water and electricity. And I wanted to emphasize that as well, that when we are calling for guaranteed housing, that also includes utilities and making sure that no one's utilities are cut off, and anyone who does not have utilities, that we restore those utilities to them. So thank you all again, everyone who was able to join us and ask your questions. Again, if you did not have a chance yet to drop your email address in the chat and you would like to have follow-up information with the panelists and links and slides and all of that, please make sure to put it there. The recording of this press conference will also be available on the Facebook page for Advance Carolina. That's facebook.com/Advance Carolina. Thank you all so much, and please stay tuned for more updates.